Hello, my name is Tarek Rajji. I'm the Executive Director of the Toronto Dementia Research Alliance, or TDRA. On this World Alzheimer Day, I would like to share with you some of the areas that I'm excited about in the field of Alzheimer and dementia. But one big area that's been growing quite rapidly over the last few years is the development of peripheral biomarkers, or what we refer to as blood tests for Alzheimer's disease. In the near future, we'll be able in the clinics to have blood tests that patients they can have, and they can confirm whether someone has Alzheimer's disease or not. This is very exciting because these tests can be administered and provided to patients early on in the disease process, even sometimes maybe at one point before even the symptoms start. Why is this important? Because it's also relevant to another area that's growing and that's quite exciting in the field of dementia and Alzheimer, is the development of new therapeutics. These are antibodies that some of them have been approved in the US and some of them may be approved in Canada soon. These are antibodies that remove the amyloid or the protein in the brain, one of the proteins in the brain that could cause Alzheimer's disease. And while there is a debate about the value of these medications or these new treatments with respect to the magnitude of their benefit versus the potential side effects, especially bleeds in the brain. What's exciting is that this is a new type of medication, new type of therapeutics, and the first generation of such therapeutics that ultimately and hopefully will see a second and third generation with better efficacy and maybe better side effect profile. Another area of excitement in the field of dementia is the better identification and characterization of what we refer to as modifiable risk factors or potentially modifiable risk factors. So these are things like hearing impairment, vision problems, smoking, physical inactivity, depression, excessive alcohol use, and many others. And what's exciting is that we're learning more and more about how these risk factors are connected to the risk of developing dementia, and ultimately how can we modify them, to reduce the risk of developing dementia and to prevent that syndrome. With all these development and all this excitement, there are challenges that come with them, and especially within our Canadian and Ontario healthcare system. For example, how can we ensure that with the new therapeutics and the new diagnostics, how can we ensure that we have an equitable system that can provide access to these new blood tests or therapeutics or these disease-modifying therapies? How can we develop models of care that address those risk factors, modifiable risk factors, to reduce the risk of dementia or cognitive decline and to prevent dementia? All these challenges, I feel, can be tackled confidently with TDRA as a network, as an alliance. TDRA is designed to be a collaborative alliance that with a great collaboration with other stakeholders in the community, and I'm confident that it can, in partnership with other stakeholders, in tackling these challenges. On this note, I'd like to add my message by thanking the TDRA community as I'm transitioning as of the end of this month to the US and completing my role as Executive Director. I'll be looking forward to hearing more about the exciting new work and new initiatives that will be led by TDRA or collaborated with TDRA. And thank you.